So continuing where I left off, this is a disease that also has to have the symptoms just kind of managed in general. And so this may include having psychiatry involved to provide medications and treatment for psychiatric disorders. This might be having a kidney doctor involved so that dialysis can occur if the kidneys are involved, and different things like that. So you're actually treating the symptoms. Dietary modifications obviously need to be made so that they are limiting foods that are high in copper, like organ meats, shellfish, nuts, and chocolate. That one would kill me because I love chocolate. But that symptom management is really used to address those complications that can arise. And the individual symptoms depend on each individual person as to how severe they are or what symptoms actually present. And so that treatment has to be very personalized or individualized. So then in severe cases, a liver transplant might be necessary to address any liver failure that could present. And it requires having a new liver just be put in place of the one that currently exists. So then from there, Wilson's disease is a autosomal recessive disorder that is caused by mutations in the ATP7 gene. The sequence, like I mentioned, it is already known, and it's located on chromosome 13q14.3. And as I previously mentioned, this gene provides that genetic framework for producing the protein that transports copper, or ATPase2. And so this protein being deformed or not being developed appropriately results in an inability to transport copper the way it is supposed to. So this disease is a heritable disease, so you can inherit it from your parents. Individuals who inherit 2 copies, and this kind of shows this on the screen or on that chart that I have included on the screen, but individuals who get 2 copies, one from each parent, will develop symptoms of the disease. So it means that it follows an autosomal recessive inheritance pattern. And individuals who only get 1 mutated ATP7B gene will normally not develop symptoms of the disease. The individual, however, has the potential to be a carrier of the disease and can pass it on to his or her children. Wilson's disease is not sex-linked, and it has poor genotype-phenotype correlation. And since it is an autosomal recessive gene, it affects both females and males equally. Due to hormonal differences and other physical differences between men and women, symptoms of Wilson's disease may also be expressed differently. The prevalence of Wilson's disease also, interestingly enough, it varies more by like the geographic area, and certain ethnic groups display a higher frequency of this mutation. So various mutations are involved in this, and they can be in different areas of the ATP7B gene, or on that chromosome. They can be in different places. And the mutations in the ATP7B gene ultimately lead to changes, obviously, in that gene expression. And the result is either reduced or absent production of functional ATP7B proteins. And so there's over 600 pathogenic variants in ATP7B that have been identified. Single nucleotide missense and nonsense mutations are the most common, and that's followed by insertions or deletions, which are the second most common. Most of the time, you don't see splice site mutations as the cause of Wilson's disease. All of the mutations in some way, shape, or form disrupt the normal function of the ATP7B protein and impede normal transport of copper out of liver cells. This results in that inability to excrete copper from the body and eliminate it as we are supposed to be able to. So then copper accumulation results, and then toxicity increases, and the development of symptoms with Wilson's disease are then seen. So there is a recommendation for individuals who are suspected of having Wilson's disease or who are planning to have kids to receive genetic testing. Direct sequencing of the ATP7B gene is the most sensitive and widely used confirmation testing method, and current biochemical testing improves diagnostic accuracy. The recommendation is ultimately made based on clinical symptoms, familial history, or abnormal test results. And abnormal test results might be something like elevated liver enzymes or abnormal copper levels in the body. And the testing usually requires the ATP7B gene to be sequenced to identify changes or mutations in the gene. And it's the most definitive way to receive a diagnosis and understand familial impacts. Since Wilson's disease has first been discovered, there have definitely been advances in the management of the disease through medications and the ability to perform transplants and just overall medical practices. However, medications are still administered with limited success due to side effects. And there's really a non-specific mechanism of action, and the requirement that the patient remain on medications for life is somewhat challenging. They also often have to take medications multiple times a day. There's a lot of universities that continue to do research on Wilson disease, and there's approximately 60 ongoing trials around the world at this time. Currently, there's also testing being completed on a new drug called tetrahyomyl. I'm saying this totally wrong. Tetrathiomolybdate. TTM is the short way to say that. But it's another current oral medication that chelates copper. It is in phase 3 testing and is being looked at for treatment with advanced stage Wilson's disease with hopes that it can be administered and have less significant neurological side effects. And then beyond that, gene therapy and hepatocyte cell transplantation are promising strategies for treating Wilson's disease, but they are not available to be safely used in humans yet. Genetic testing remains the most preventative technology identified for working with the disease if there is a known familial history or high risk factors. And there's not a specific way to prevent it from developing, but if they intervene earlier and prevent it from ever starting to cause problems, it makes it more manageable and treatable and reduces the progression of Wilson disease symptoms. So with that, that is my presentation. Hopefully I answered all the questions, and thanks for watching.